Senior Analyst at the Kansas Health Institute, and I will be your facilitator for today. You are the Access to Services Working Group. This is the meeting for that working group, and this working group was convened by the Senior Care Task Force. This is meeting number 7 today. We're going to continue hearing from some experts today, and then you will begin developing recommendations around your topic of senior daycare resources. So, as we've done in several other meetings in the past, let's kick off this morning as well by introducing yourselves. And then I also want you to really think about the topic in mind and provide a sentence or two about what you would like members of the working group to really, keep front of mind as you continue to hear from experts and develop these recommendations around senior daycare resources today. So I'm going to first invite your chair, Sarah, to introduce herself, welcome all of you, and provide some comments.
Hi, I'm Sarah Schlitter, Director of Residential Services at Johnson County Developmental Supports. And I would just like us all to just keep in mind accessibility to different senior daycare resources in both urban and rural areas. Thank you.
Thank you. Next, I'll invite Annette.
I'm sorry, I'm a little late joining in. What are we supposed to do? I'm Annette Graham, representing the Kansas Association of Area Agencies on Aging.
So Annette, if you could provide, in a sentence or two, what you would like members of this working group to really keep front of mind as you continue hearing from experts this morning and develop recommendations around senior daycare resources.
Around senior daycare. Accessibility to services for individuals 60 and older across the state, because there's also scarcity of that service in the urban areas as well.
Thank you. Dan?
Good morning, everybody. Dan Goodman, the Assistant Commissioner for Long-Term Sports and Services. I think my thoughts would just be parroting what Annette and Sarah have already said. So,
Okay. Heather?
Heather Brown, Johnson County Developmental Supports. Just thinking about how we can raise awareness about the availability of senior daycare centers, and also realizing that there is a difference between senior daycare and day services for our older population that has intellectual disabilities.
Thank you. Stacy?
Hi, can you hear me okay?
Yes.
Great. Stacy Carson from Johnson County Developmental Supports. And I think something that's important to me for us to keep in mind is using resources that already exist and expanding on those, whether they be like the traditional senior centers or having individuals from different waivers possibly be able to use day care centers that already exist. Thank you.
Thank you. Tanya?
Good morning. I'm Tanya Dorff with Oral Health Kansas. I love all everybody's comments already. I think I would add something I think I've added several times, which is just thinking about everything that goes into helping a person be healthy and productive and happy. And so just kind of a whole person approach to health and access.
Thank you. And I see that someone is joined by phone number ending in 65. Would you mind introducing yourself? All right. Well, we'll help. Oh, go ahead.
No. So I'm jumping on the call just from my phone, and there were some questions that had been posed that we just received because we didn't get the email since it was in the junk mail. So I'll do my best to get you answers to those questions. I didn't know if you wanted me to stay on the call. I had presented at the last meeting.
I will leave that up to your comfort level, but I will reach back out to you when we get to that portion of the agenda. So thank you for being on the call. And then I think I saw Senator O'Shea join. What we are doing right now is introductions, and if you could provide a sentence or two on what you would like members of this working group to keep top of mind as you continue hearing from experts and develop recommendations around your topic on senior daycare resources today.
Thank you. Good morning, everyone. Senator Kristen O'Shea, and then baby Leland's here too. And coming to you from Topeka, I'm always curious, specifically from the policy standpoint, what can we do policy-wise that will make these opportunities more available, and just, you know, from a policy standpoint, what can we do to help? Thank you.
Thank you. And so I want to make sure I'm not missing anyone, at least from this working group membership. But also I'll call out names. Jamie, are you on? I know Jan won't be able to join us this morning. Linda, are you on? And then Sean, are you on? All right. We also have Sean Marshall from KLRD on. Also from KHI, we have Emma Urich on, and then of course we have our technical experts from CLOIS on as well. So I'm going to share the agenda really briefly again, just to remind you of kind of what we'll be doing and also some meeting commitments. So the representatives from CanCare managed care organizations are available, as well as some experts that you heard from at your last meeting are available for Q&A only. They won't be presenting again. And then you will hear from Tanya Dorff Bruner and also Ernie Cutzley, their presentations that we weren't able to get to last time. And then after that, we will use that Jamboard tool again to begin recommendation development. And for those members that aren't able to attend today, we may send out a quick survey afterwards so that we can collect their recommendations. And if any of you have thoughts after, to collect them from you as well. We'll also talk about some quick administrative updates, and I also want to make sure that you have your meeting commitments in mind to come ready to discuss and compromise. Keep your remarks succinct and on topic. Don't hesitate to ask clarifying questions, and I'll make sure that we start and end on time. So with that, I think I saw one more person come on. Oh, Kendra, would you like to introduce yourself?
Sure. Good morning, everybody. I'm Kendra Baldridge. I'm the director of the Bureau of Community Health Systems at KDHE.
Thank you, Kendra.
Thanks.
All right, so before we jump into kind of Q&A, you did have a few different data requests. So we will reach out to a representative at CDDO and also to KDADS on really getting you statewide numbers of 60 plus folks with IDD, and also those that are in need of those day services, and then the number of age 60 plus on the waiting list. And then I can't remember who was on the phone. Heather, was it you or Shelby?
It's Eileen Doran. And
Okay.
Shelby is not on the phone, and I'm with Shawnee County and TARC. It's
Perfect.
Shawnee County CDDO.
Perfect. Would you be able to provide some of the information that was requested on the number of clients you serve, and maybe talk about the population who are not served if you're ready for that? Otherwise, you are welcome to send this via email.
Well, I will send you some of the specific numbers. Yes, I had apologized when I first got on because Shelby, the invite went to Shelby with the questions, and it went to her junk mail. So she opened it this morning around 8:30 and did her best to get in touch with me. So while this call's going on, I'll do my best to come up with some of those numbers. I think that what we were able to provide last time was just the fact that we do gather that information. We do know how many for our county are over 60 and on the waiting list still, but we don't know that statewide, but KDADS will have those numbers. I can also share some anecdotal information about some of the challenges that folks who are over 60 in our services are having, as well as how somebody ends up over 60 and still on the waiting list, and what those needs might be and how we attempt to address them.
That would be helpful for you to share. So when that is available, you're welcome to share it. I can reach back out to you maybe after these presentations if you have any of that information readily available as well. Thank you.
Okay. Yep.
Also from Julie Govert Walker, she was not able to attend the meeting today. You did pose a question if there's areas in the country with an adult day service model that works. That the working group can think about. You know, sometimes when you are, the conversation was around really thinking about senior care centers and facilities and kind of having an adult day program in there as well. And so one thing that she did follow up and say, two ideas that the working group could consider, and she will send more rounded recommendations later. But one thought was thinking about maybe funding a pilot program in rural and frontier counties, and thinking about planning an evaluation component to be included in those pilot programs. The cost and such she would have to think through, but really thinking about piloting the idea, in some parts of the state, really thinking about rural and frontier counties to be included in that pilot. The second recommendation that again she is working on, we're providing language, would be around KDAD's revitalizing the Advisory Council on Aging. And based on the COVID experience, thinking about expanding membership to include community-based practitioners. And I don't know the membership at that time, so if someone can speak to that, let me know. And then again, expanding membership to make sure those from rural or frontier parts of the state are really included on that advisory council. So those were two thoughts that she wanted to put forward, and she will continue researching on, if there are other states that have a model that Kansas can look to. And then with that, any other questions for either of them before I go on? All right, well, you also have your MCO representatives on today. I see Melody from United Healthcare, Jennifer from Aetna, and Nan from Sunflower. So based on their presentations from last week, I know that your time was, or 2 weeks ago, your time was cut short. What questions do you have for your representatives? Would it be helpful if they gave you like a 2-minute synopsis? Yeah. Can I put you guys on the spot, Melody and Jennifer and Nan? Melody, could we start with you? Just like a quick 2-minute on access to services. Or I see Jennifer. She opened her camera. We'll start with Jennifer.
I know I opened my camera too soon. No problem. I can do a brief synopsis. We've done a couple of these, so I'll try to make it referencing the material that we reviewed at the last meeting. So for us, we just did some kind of conversation around, I think, some general kind of workforce issues, access to services. I mean, for us, we did a double back in terms of just utilization around daycare services for adults 60 and over. Did a little bit of research just in terms of our current provider network and utilization of services. I'm having some internal discussions with my team just about access. I think coming off of the last couple of years, certainly with the pandemic, there's been some maybe impact to utilization of this particular service. So we're looking at this service. Again, it's not a service that's overly utilized for 60 and over, especially even for the FE benefit under senior daycare services. So I'm learning a lot from this group in terms of just barriers and access and resources across the state to see if there's something that we can do on our side to re-engage with providers who might be reluctant or not receiving referrals, to see if there's access issues for members who might be interested in the service. what those barriers are and how we can just kind of get them connected. So I'm sure that that wasn't an exact summary of what we provided last time, but those are just sort of my thoughts participating in the last meeting and the notes that we had and things, kind of takeaways for us.
Thank you. Melody and Nan?
Hi, it's Melody. Mine is similar to JP's. I did go back and look to see what senior daycare providers we actually have contracted within the network and what the utilization is, and it's very low. Did talk with our network folks to look and see, are there additional daycare providers that we could be contracted with, and there's actually a list out there, but as we're digging into that, we're finding that those places are closed and have not maybe updated with the state that they're no longer providing services. So we're continuing to work that list to see if there's any opportunity to add to the network, but it's not looking like there's a lot of available providers out there that we're not already contracted with. So that's just kind of a summary of what I've figured out since participating in some of these meetings. Our presentations were more around workforce shortage issues, technology solutions. Our service coordination process is really what we've focused on in our presentations.
Thank you, Melody. Nan?
Yeah, and I would just reiterate what they've said, definitely looking at, the provider shortage was one of the things that we talked about in addition to kind of our value adds, and then supports around either diagnosis specific telephonic case management or social isolation, different technology solutions that we might be able to bring into the space. And help support. And the direct care worker shortage is just something that is both in individual situations as well as groups. So.
Thank you. So any questions from the access to services lens?
Hi, this is Annette Graham with the Kansas Association of Area Agencies on Aging. I think it was the first speaker mentioned that second speaker mentioned that there is a list of adult day services. Can we get access to that? Because I don't recall seeing a list of service providers across the state.
That's Melody from United. So the network folks, I believe they go and they look at the KMAP list. There's a KMAP list of folks that are licensed for that, and that's the list I'm referring to. I'm not sure exactly where that is in KMAP, but I can find out.
Thank you. And maybe that's something that the state can provide us. And then I just want to make a second comment was that I think there was reference that there's not a lot of interest or you don't see a lot of utilization from consumers, those on the FE waiver. So I just want to say from a historical perspective, as being an area agency on aging director and working with colleagues across the state who do provide services and under the Senior Care Act program, that is a service category that is available. But I don't know if any AAA utilizes that. It would be very minimally utilized. And our history locally here in the Wichita 3-county region where I work was that older adults themselves would rarely request the service. Who would be more likely to request or be a more likely target for discussion of the service option is caregivers. They're the ones more likely to say, wow, we really see this need and we really need to help. So I think that conversation with family members is often what is kind of critical to getting an older adult interested or willing to utilize that service. So just a perspective there on that.
Thank you. Any other questions for representatives from MCOs? Well, thank you for being with us this morning. All right, I'm going to turn us then to our presentations. So we'll start first with Tanya. So I'll invite you, Tanya. Would you like me to share your presentation or would you like to share it yourself?
share it if that's okay.
Yep, I will make you a presenter.
Thank you. Okay, I think that should be on there. Great. Well, I do want to thank everybody again. My name is Tanya Dorff with Oral Health Kansas. I want to start a timer so I can make sure I don't go over. I appreciate the chance to visit with the working group this morning. And I recognize that part of what I'm going to share is probably a little bit farther afield than some of the other issues we've been talking about, but I just think it's maybe some issues just to bring to the forefront as the working group does its work on day services and then on other issues as well. So just a very brief background about Oral Health Kansas. Hopefully most everybody is familiar, but we are the state's consumer oral health advocacy organization. And we really focus primarily on doing advocacy work and then oral health education for a lot of underserved populations. Older adults are certainly one of our target areas, as are people with developmental disabilities and people with all disabilities. So I won't belabor that too much, but we'll get into some content. I want to just also preface this by saying people always talk about, oh, we need access to oral health. We need access to oral health. And we did a whole lot of thinking several years ago about what does that actually mean? And so we've broken it down into 3 buckets. We think that if you have access to a dental provider, if you have access to dental coverage or health insurance, a dental insurance, a way to pay for services. And then if you know how to take care of your oral health, if you're aware of how and why to do the daily oral hygiene at home, how and why to access professional dental care. If you have all these things, you're really able to have good oral health. So when we talk about access, we really think about providers, payment methodologies, and then the knowledge and understanding. Just briefly, what I want to talk about this morning is the value of oral health to overall health, and then some facts and coverage and solution ideas from Kansas. And I kind of giggled when I looked at these slides again this morning because I put these slides together during one of the last snowstorms that shut down the Capitol. And today we certainly are not having that. But it's a pretty picture, so enjoy that. So first of all, just a little bit about the background of the value of oral health, and hopefully you know a lot of this, so I won't go into too much detail. I think we all know tooth decay is entirely preventable. You may not know cavities are the most common childhood chronic disease. It's more common even than asthma. And about 25% of kids will actually have tooth decay before they even enter kindergarten. And so those are issues we're really trying to work on to get people a healthy start so they can be healthy throughout their entire lives. I do want to note that chronic diseases like diabetes and heart disease are really exacerbated by dental disease, and dental disease means both tooth decay and gum disease. There's a real strong correlation between both diabetes and heart disease and others. So it's a systemic issue when you have infection in your mouth, and it can certainly injure the rest of your body in many ways. It's also the reason we're really here. We're here about access. So oral health certainly is out of reach for many, many people. I put that first bullet there about dental care is largely viewed as cosmetic because I think that's if we're lucky, we get to view it that way. If we're lucky, we get to have access to a dental provider that we can go whenever we need. We have coverage. We can handle the payments, and we certainly see. Commercials are all about pretty white teeth, and so that's how I think we often see this issue. But it's a true health issue and it's a true access issue because, and you can see there are people living in poverty, people of color, people with disabilities, older people living in rural areas really struggle to be able to access in all those 3 buckets I mentioned earlier, access good oral health. And of course, dental insurance coverage is not accessible to everyone. It's as an add-on for both public and private plans for the most part, which increases costs, decreases access. And so this is why I'm here today to talk about it. So I'll jump now into some facts and some coverage issues here in Kansas. For the last couple of years, we've introduced, I can't think of the right word. We've introduced released a report card that compares Kansas oral health data to national statistics, and so we can compare where is Kansas relative to national measures. Overall, Kansas for the last 2 years has gotten a C. That wasn't necessarily a grade my family would have been happy with if I brought home. So, and I'm not necessarily happy that we're at a C. I don't think that's great. But these 2 measures are they show that we're pretty much in line with where the rest of the country is right now. About a little less than a third of older adults have lost 6 or more teeth because of gum disease or tooth decay, and about 14% have lost all of their teeth. These are the only 2 older adult measures we have on our report card, and I just bring up the number of teeth issue because the marker is essentially when you get to about having only about 20 teeth left. That's when you really start to impact your overall health and your ability to eat and be healthy. So that's this tooth loss issue is a really important thing to focus on. This is a survey. This is some data, and it's pretty new, so I don't have really a lot of insight to offer. I just wanted to share a couple of thoughts about this, though. Every few years, the KDHE Bureau of Oral Health does a survey of nursing facility residents. What they do essentially is a screening. They go into nursing facilities and with a statistically representative sample and screen people's oral health. So they take a look at natural teeth, take a look at dentures, and take a look at decay. One fact I might point out that I think is interesting, and I can't tell you this for sure, but I think we understand why. If you look at the 2018-19 survey, there were about 21% of nursing facility residents had untreated tooth decay, so about 1 in 5. That more than doubled by 2021, but the other thing that happened, of course, is the pandemic, and access to dental providers just really dropped off precipitously once the pandemic started. So I think that's probably one reason this really jumped up, and I'll be eager to see what that looks like in another few years. This is the detail that I really want to focus on this slide. The survey showed that almost half of residents who had teeth had substantial oral debris. That means they had food stuck in their teeth. And it doesn't mean that you just had corn on the cob for lunch and you need to floss. It means food's probably been in there for quite some time, and it's not getting taken out. So what that really means is people, a large number of folks, or almost half the folks in the nursing facilities, are probably not getting daily toothbrushing, making that a part of their routine. So that's an area that I think we really need to be thinking about in terms of people's health. This is, I won't bore you with the details, but I've got the links to where these data pieces come from. But the first thing, I keep focusing on loss of teeth, but the good news is, 50 or 60 years ago, people expected to lose their teeth. People retired and they probably had dentures. It was extremely common. It's not so common anymore, and that's good, because we've got access to community water fluoridation now. We've got fluoridated toothpaste. We've got better dental care. We've got better education. Lots of things that have improved to make that much lower risk for folks. But this statistic on the right, this is based on Kansas data. This just breaks my heart. 84% of low-income adults say, I accept that I will lose some teeth with age, and I don't accept that they accept that. I think that's not okay, that older adults just have to feel like that's going to happen to them, because so many other really bad things can happen to their health when they do lose their teeth. A couple of other just quick notes here. Dental implants, we hear more and more about those. They're a very safe and effective way to replace lost teeth. It's a great service, but they're super expensive and they're pretty much out of reach for a lot of older adults. And then, of course, we all know older adults are living much longer. When you live much longer, you live with more chronic diseases. So this bullet is just about, it's important to note that that medical and dental professionals work together, that medical dental integration is a part of people's lives to keep people healthier longer. I think we've kind of gone through most of these things here. It just, I think maybe this is one I might focus on right here. People who are hospitalized are much more likely to get pneumonia if they have dental infections. If you've got decay in your mouth, or if you've got gum disease, the bacteria gets into your system, and it's much more likely that you'll end up with pneumonia if you have that kind of an infection. So that certainly affects a lot of older adults who tend to be hospitalized a little bit more prevalently. I think I'll just skip the rest of those because you can read those on your own. So the next bit I want to talk about is coverage. I would assume this group knows, but in case you don't, Medicare does not include dental care. That's a surprise to a lot of people who work their whole lives, pay into the Medicare program, get to Medicare eligibility, and then discover that it does not include dental care. Medicare supplemental plans, by and large, do include dental care, which is great, but they're pretty much unaffordable for many older adults. And then Medicaid coverage of dental care is not available in every state. It's not required for adults, so it's not available in every state, which is a problem. I'll talk about that here in a few minutes about what's happening in Kansas, because I have some good news on that front. So this is some data that we actually were able to contract with the Kansas Health Institute back in 2020 to look at an existing data set and analyze the extent to which Kansans have access to dental insurance coverage. So this is just pulling out a couple of slides of data related to older adults. And I think this is all related to older adults 65 and older, just because that's the way the survey data broke it down. But you can see about 51% of older adults did not have dental coverage, 48% did. That pretty much, jives with what we saw on the last slide about Medicare and Medicaid coverage is a problem. This next bit breaks down those numbers a little bit further. So you can see that a quarter of older adults have dental coverage from something like a Medicare Advantage. So, there's certainly a chunk of the population that can afford those Medicare Advantage plans, which is great. About another 20% or so have an employer-sponsored coverage. So that means folks are, still working into their older years, which is also great. But you can see pretty much the rest of the population is uninsured. There's a little bits there, but pretty much everybody else is uninsured. So that comes back to Medicare doesn't cover it, Medicaid doesn't cover it. It's pretty much out of reach for older adults. So just to end here with some solutions. First of all, there's a couple of things in progress that are really, really great pieces of news. In 2019 and 2020, both, the Kansas Legislature approved dental rate increases in Medicaid for the first time in nearly 20 years. I don't have to say to this group, Medicaid rates are low. Medicaid rates are low for every service there is. It's a perennial problem, and this is why we just heard the MCOs talking about how provider networks in any sense are hard to access because, rates are a big part of that. But we did get 2 rate increases, which certainly goes a long way. And then the FY 2023 budget approved right now by both the House and Senate. It's not in recommendations anymore because as of this week, both the House and Senate have passed budgets that include funding to extend Medicaid dental coverage to adults. This is incredible news. We've been working on this for more than a dozen years. You guys know the budget process, so it's a few steps away from this being finalized, but both the House and Senate have included that funding and included language in their budget recommendations that say Medicaid coverage will be extended to adults. And I'm grateful to many people on this call who were a part of the advocacy effort to help us get to this point. I just list a few ongoing needs here. First of all, I've talked a lot about Medicare dental benefits. That's a huge issue that needs to be dealt with. Obviously, it's a federal issue. Last year, Congress got the closest it's been since 1965 when Medicare and Medicaid started to actually adding the dental benefits. There's a lot of bipartisan interest in this issue. We all know the legislative process is slow, and so talks broke down, but we're hopeful that we can kind of continue that work, and we're working with a lot of national colleagues on that issue. Including dental care and daily toothbrushing in HCBS and institutional plans of care is something we're keenly interested in. This is an area we haven't really dived into yet, but we think it's something that really could make a big impact on people's just their basic health. And I mentioned this earlier in that survey that about 50% of the folks living in nursing facilities might have oral debris sitting in their mouth. So including dental care, including daily toothbrushing in those plans of care is going to go a long way to helping people stay safe. We do need to be doing a lot more education for dental providers, and this means dentists and hygienists, clinics, about how to meet the dental needs of older adults and adults with disabilities. Those can be populations that are a little bit intimidating for dental providers. So that's ongoing education efforts are happening, and that needs to continue. Creating incentives for hospital-based dental care, and I didn't mention this earlier, but just briefly, some people are not able to tolerate dental care in a dental office. This especially is true for a lot of people with IDD. So there's a way to get some dental care in a hospital-based setting under sedation. It's very, very, very hard to access because there's very few providers that do this. It's expensive and the rates are low. So this is there are ways to look at how to create some incentives to make that an easier service to provide, and that would really help a lot of people stay healthier. We've got the CanCure reprocurement process coming up, and we could certainly be focusing on dental care access in that process. And then a couple of just data needs there as we worked with the Kansas Health Institute on that dental insurance coverage study. It really pointed to the need to get better and more consistent data so we have a real good sense of what the coverage is for children, adults, older adults in Kansas. And then also didn't mention this too much, but emergency room usage for dental pain is another problem area. Lots of folks, if they don't have access to a way to go to a dentist or pay for it, and they have some dental pain, they're going to go to the emergency room, but you can't provide any dental care in an emergency room. People walk away with a prescription for pain medicine and prescription for antibiotic, but you don't get any dental care. So that's a real suck on the emergency room's time and space, and it's also very expensive for people to use it, and you're not getting care. So, but we don't have really consistent data in Kansas about that either. So that's an ongoing need I think we ought to be taking a look at. And that's a lot of stuff to cover very quickly, but I do appreciate the time and super happy to stop and have a discussion and answer questions. Thank you.
Thank you, Tanya. Questions? It looks like you were thorough.
Hi, this is Annette Graham, Kansas Association of Area Agencies on Aging. Thank you for that presentation, Tanya. I just had a question. I know in the past there had been work at the legislative level on the mid-level dental practitioner. Is there anything going on with that, or where I know several other states have passed that and have that mid-level practitioner that really does focus a lot on those underserved populations and the Medicaid population. So is there anything going on with that?
Thanks, Annette. And again, Tanya Dorff with Oral Health Kansas. That's a great question, Annette, and I'm glad you asked that. In fact, I literally just visited with a dental therapist from Minnesota yesterday. They're pretty progressive there in that policy area. It's the issue is kind of stalled in Kansas. There was a bill under consideration that was introduced by the Kansas Dental Hygienists Association last year. It had a hearing. It got close to having a vote this year, and one of the snowstorms stopped it. So I think it's still on the radar. It hasn't had as much steam behind it in the last few years, but I think you eloquently pointed out the value of that practitioner in order to meet needs of underserved folks, in order to really focus on Medicaid populations. So thank you for eloquently pointing that out.
Any other questions? All right. Well, thank you, Tanya. I will turn it over to Ernie then. Ernie, did you want me to share your handouts on the screen, or would you like to speak to them after introducing yourself?
Would you share them, please? I would appreciate that greatly. Thank you.
Of course.
You ready? Oops, no, not quite.
Ready for you.
All right, thank you so much. Appreciate it. So Ernie Cutzley, AARP Kansas, thank you for this opportunity to be here. AARP has more than 38 million members nationwide, 280,000 members in Kansas, dedicated to enhancing the quality of life for all as we age. So thank you for this opportunity to talk about the LTSS scorecard, as we call it for short. Appreciate it greatly. We going to look at the last scorecard, which was released in the fall of 2020 with funding from the SCAN Foundation, the Commonwealth Fund, and AARP Public Policy Institute. So this is the fourth edition of the scorecard. As I said, it was released in the fall, and it looks at the LTSS systems, this one specifically Kansas, that serves our older adults, those with disabilities, and family caregivers. So the goals of the scorecard are to raise the national level of performance for LTSS and to help states measure progress and identify areas for improvement in their systems and opportunities to learn from other states. The scorecard does not look at how well states or communities are managing or have managed COVID. All data featured in this 2020 scorecard was collected and analyzed prior to COVID-19. So there are two attachments. The first one is the one that Hina has up. This is the unedited version. The scorecard examines state performance both overall along 5 key dimensions and 26 indicators reflecting the importance each has on the overall LTSS system. The data indicators are based on the vision of a high-performing system of long-term services and supports established in 2010 by AARP's long-term care services and supports experts. As you can see at the bottom of the page, overall in Kansas, comparison of Kansas with other states, we rank 37th. And we feel that Kansas has numerous opportunities for improvement from the 2020 scorecard. In particular, the support for family caregivers and effective transition dimensions have each multiple indicators that we can draw attention to as areas to improve performance. In addition, there are indicators within other dimensions with similar opportunities. Also attached is the edited Kansas state fact sheet. Let's see, can we bring that up? I'm sorry. Thank you. Very colorful one. Also attaches the edited Kansas state fact sheet and detailed indicator descriptions highlighting 9 indicators across all 5 dimensions that could be improved upon. While 26 indicators could be improved upon, those highlighted in red are those where Kansas lags significantly behind the best state and/or national average. Those indicators highlighted in yellow are ones where Kansas falls below the national average. Several of these indicators, particularly within the support for family caregivers dimension, are compromised of policies that could be implemented with relative ease through either executive order or leverage legislative action. And we looked back in 2019, we looked at flexible sick leave hours for employees that had sick leave opportunities, that they could use part of those for family caregiving, and that had a hearing in one of the committees and was tabled because of the Kansas Chamber and some other folks that thought we were interfering in their business and employers' business. We also looked at the Kansas Life Caregiver Act in 2017 and the last few years, the APRN scope of practice, and then worked closely with Chairwoman Concannon and committee members in support of this task force effort. So we're greatly appreciative of them and their efforts. So the key message is to take away from the scorecard, highlights needs to shift more to community or consumer options for home and community-based services, both because it's far more efficient economically and because it meets the wants of individuals and their families. And we know that the highest performing states do not necessarily mean that they spend the most money on home and community-based services. They effectively leverage the public and private sectors, meaning more efficiency and affordability. So we believe that ideally all states would have high-performing LTS systems in which older adults have choices in both quality services and providers. So once again, thank you. And on the first slide that Tina had up is the full report is available at www.longtermscorecard.org. So with that, I appreciate it. I'm getting some kind of low warning light on my phone, or my computer. So sorry. So with that, thank you very much. I stand for questions.
Thank you, Ernie. Have you all had a chance to take a look at this, or would you like me to continue scrolling through this document? And I can do that. So some of the indicator descriptions, you have affordability and access here, choice of setting and provider. This is also in your email inboxes if you need a larger look or closer look, quality of life and quality of care, support for family caregivers, mandatory paid family leave and sick days, as Ernie had mentioned. Flexible use of sick leave, again, that he mentioned, support for family caregivers, state policies on financial protection for spouses of Medicaid beneficiaries who receive HCBS, state assessment of family caregiver needs, support for family caregivers, so nurse delegation and scope of practice, again, that he touched on. Transitions, so something this group has talked about. And that is it. Questions for Ernie, or would you like me to scroll back? Otherwise, I'll stop sharing. I don't want to
Heather
do
Brown, Johnson County Developmental Supports. Noticing on the scorecard, it refers a lot to HCBS. Is that just HCBS for frail and elderly, or is that encompassing all HCBS services? Waivers, I guess I should say.
I'll have to check on that, but I believe it's for all HCBS or HCBS services, pardon me.
Other questions? All right. Well, thank you for your time this morning then. We'll give the group a chance to digest the report and maybe add to their recommendations after that. If there's any other follow-up questions, I will follow up with you.
Thank you so much. Thanks, everyone. Have a good day.
Thank you. So any discussion about what you've heard this morning, I do want to share, as I got it at 9:02 this morning, more eloquent document of the recommendations that Julie Gover-Walter from North Central Flint Hills Area Agency on Aging and Michelle Morgan, who you heard from last time from Northwest Kansas, their proposed recommendations to this group. So the first one is revitalize KDAD State Advisory Council on Aging, that is required entity under the Federal Older Americans Act, with the goal of creating a robust group comprised of practitioners, planners, and advocates oriented to addressing issues focused on community-based services to meet the needs of older Kansans and caregivers in all parts of the state. The second one is urge the KDAD's State Advisory Council to review, research, and endorse initiatives related to adult day services that meet the social needs of Kansans and caregivers, with particular emphasis on needs in rural Kansas. The third one is to ensure adequate resources at state level to maintain and enhance robust community-based service networks established by area agencies on aging. And the last one is around create or identify special and specific state funding for identification and addressing barriers and to enhance qualifications and availability of staff at senior centers who take on additional responsibilities for adult day service models. Area agencies on aging to pilot adult day service models in rural Kansas communities and senior centers or community center locations to meet the social needs of vulnerable older Kansans and their caregivers. Area agencies on aging for research, planning, coordination with potential partner groups, implementation of adult day service models, and then evaluation of these adult day service models so that best practice for replication in other areas to meet needs to be accomplished. All right, I will drop these into the chat box if you would like to adopt or add any of these or modify them for your list of recommendations. So while you're doing that, we will drop them into the chat box for that. Any questions or discussion around these recommendations? And the other opportunity I'll give is I think Sean joined the call. So Sean, would you also like to introduce yourself if you have any comments on this, or if you, the prompt that I had given this morning was 1 or 2 sentences of what you would like the members to keep front of mind as you continued hearing about this topic, and you will develop recommendations around senior day resources today.
Good morning. I apologize for being late. Sean Sullivan with Midland Care. I think these are all good suggestions, and probably go to my 1 or 2 sentences, which is continues the need to be innovative in what we're thinking and how we approach creating a higher level of access to services. So using adult day services as an example, I think there's a need to be innovative in thinking about that and creating new models that support existing services that can go above and beyond offer adult day, because I do think it is a critical gap that is there in most places of the state. So that was more than 1 or 2 sentences, so I apologize.
That's okay. Thank you. All right, then it is Jamboard time, where we will start developing recommendations on this topic. So Emma will drop this link into chat. As you have in the past, please go to the link. I will try to make this as big as possible. And again, this first board, though, is looking at using your strengths to take advantage of opportunities. And so I'll give you about 5 minutes. And then if anyone is having difficulty with using Jamboard, you can always use the chat box and MRI will transfer your recommendation to the board. So I'm seeing some recommendations around utilizing existing services, so leveraging your resources, allowing IDD day service providers who have an older adult program to also serve older adults from the general population, either through PACE or other means, so policy oriented, connecting with community partners who also provide day services. Thought I'd seen one on a pilot program as well. Would anyone care to share their recommendation and provide some kind of context around it, any clarification or rationale for it? All right, I'll give you about 2 more minutes. It looks like there's still a few being added. And then meanwhile, Emma is dropping into chat the recommendations from the 2 area agency on aging experts that spoke at the last meeting if you would like to adopt any of their language. Another one, continue to expand and encourage service flexibility for more individualized approach. All right, let's move on to our next board. So on this next one, you are looking at the opportunities and weaknesses you had identified. So how to overcome weaknesses by taking advantage of opportunities. So I will try to make this board bigger as well and give you 5 minutes to provide recommendations around senior day care resources when looking at opportunities and weaknesses. And again, you can toggle back and forth using these arrows. All right, so it looks like there's some recommendations around utilizing technology to fill service delivery, expand and share services, so transportation programs to increase accessibility, existing community services to develop social models, increase funding and reimbursement rates to daycare and day services providers to allow more staffing and more opportunities, to serve people from their homes during the day versus going to a facility. Again, would anyone like to share their recommendation or provide more context around it or rationale? Raised awareness about this kind of service so that senior daycare resources exist in their community. Maybe about 2 more minutes. Focus on social models rather than medical models, which increases the availability, reduces costs, and meets the need of older adults and caregivers seeking services. So there's 2 about raising awareness. One is raise awareness about this kind of service, and the other one is raise the awareness to potential providers that they could become a licensed adult daycare facility. So I would appreciate clarification. Is the one about raised awareness about this kind of service more for the consumers, so the age 60 plus population, to make sure they're aware of those services in their community? Okay, maybe when we look at the list, we can add more clarity around that. All right, let's take about 1 more minute and then we'll go to the next screen. All right, so again, if you are still working on it, you can toggle yourself after. So now we're going to look at strengths and threats. So using strengths to avoid threats. I'll try to make this board bigger and take a few minutes to write recommendations surrounding using strengths to avoid threats. So I'm seeing some senior centers are an existing entity in most communities. So use this existing infrastructure, so leveraging that. Share and encourage collaboration between agencies and programs. Add educational programs to day services to discuss issues. And then with transportation challenges, go to where seniors already travel, like grocery stores and churches. Once services are developed, market the programs to caregivers who are in need of respite, incentives for employees, Again, would anyone like to share, provide context or rationale? I'll give you about a minute to finish up. All right, it looks like no more, there aren't any more, so I'm going to move on to the next screen. So now we're looking at threats and weaknesses. So minimizing weaknesses and avoiding threats. Are there any remaining recommendations around this that you would like to propose? Give you about 2 minutes to start. And then if we need more time, we'll take a little more time. So minimizing weaknesses and avoiding threats. So using technology for service delivery gaps. And promoting independence when appropriate. Utilizing volunteers and natural supports for transportation challenges, sharing resources among providers to minimize costs and expand accessibility, involve non-traditional stakeholders, so community members to develop pilot programs, getting younger individuals like high school and college age students for volunteering. So it looks like the themes here around volunteering and technology. All right, let's take about 1 more minute. get 4-H or Boy Scouts involved to be part of programming. Partner with Alzheimer's Association and AARP to access resources, training, technical assistance for volunteer engagement. Change in policy and funding to allow shared resources. All right, I'm going to move on to our last board, and this is typically our catch-all board. So any last recommendations that you felt didn't fit in the SWOT analysis framework, but you wanted to pose to the group in the preliminary set of recommendations. So I'll give you a few minutes. So there are recommendations around discontinuing adult daycare services since there are so few, and reorganize that funding and pour it into existing services that are working well, such as senior centers. Incentivize or encourage collaboration between program or services to increase accessibility and choice. There's an emphasis on childcare issues and needs. Why can't children and seniors partner more? Is this a question for the group? And I ask that because there are some children senior partnerships around the state where they have programs where childcare centers and senior community centers will partner. There's like reading programs, arts and crafts, a few different things. Happy to send that testimony. I think it was presented to the legislature a few years ago of a few initiatives around the state. Oral hygiene care should be part of the person's plan of care or daily routine. So incorporating that, whether it's in day services or another mechanism. Could someone tell me what RVP stands for? So partner with RVP and senior companion programs to utilize the volunteers in adult day service programs.
Yeah, I'm sorry, this is an acronym, Kansas Association of Area Agencies on Aging, and I meant to write RSVP. RSVP and the Senior Companion Program are both volunteer programs through AmeriCorps. And
Okay.
many communities have those programs in place and utilize older adult volunteers age 55 and older to do different volunteer programs and projects.
Okay. So continuing on that theme of leveraging other volunteer organizations to kind of support these efforts.
Thanks for your edit.
All right, let's take about 1 more minute. All right, I don't think I'm seeing any more. And if you are continuing to add them, that's okay. You can continue adding them and we will compile them in your preliminary list. All right. So I am going to pull up what your list is so far. Before I do that, would anyone like to share or discuss kind of one of their recommendations? Okay.
This
So
is, I'm sorry, it's
go
late
ahead.
to the clicking. This is Senator Kristen O'Shea. I'm just noticing, especially this year, there's just so much conversation about childcare. Um, and I feel like with some parties, it's like their pet platform of free childcare. We need more childcare. And this idea that will increase economic development because it will get people back in the workforce, which I'm not super convinced completely of that, but I wonder if somehow we could join in that messaging and somehow find a way to say, there's also extreme needs for caregiver care and senior care. And I don't know. I just wonder if there's an opportunity there, kind of in the political sphere. Thank you.
Thank you. Any thoughts behind that? Additional thoughts? All right. Well, anyone else want to share before I share my screen again?
Hi, Annette Graham, Kansas Association of Area Agencies on Aging. And I just wanted to just kind of briefly say a comment about senior centers. So senior centers are in existence across the state. They each look very different. They each have different types of funding. Many of them rely heavily on county tax dollars funding. Some of them serve as adult at congregate nutrition sites. I think Julie referenced them as friendship meals. So that's a program that's funded through another source that they provide a site. So each senior center is a bit different, but they are an existing resource in most communities. Some of them have full-time staff, some of them just have volunteer staff, so they're very, very different. So utilizing them because they're an existing infrastructure would be an opportunity and an option. Most seniors and older adults are aware of their existence in their community and frequent them as kind of a focal point for service delivery or for stop at your neighborhood level for some information on older adult services. To use those, however, there would need to be training and support and funding to provide to help them develop a social model and to be able to staff that. So they would need that expertise and assistance and support to do that. But I think it is a good opportunity and option to look at because they're an existing infrastructure with a building, with space, with, that already in place. They would just need some additional resources and information and technology and other resources pumped in.
Thank you. Any others want to share? And Heather, I don't want to put you on the spot, but I remember in chat and also during your introduction today, you had made a comment about IDD services and kind of senior daycare services and making sure that people kept concepts and context in mind. So would you mind reiterating that?
Thank you. Heather Brown, Johnson County Developmental Supports. I was actually going to chime in anyway, right after that last one. There is a difference between day services for adults with intellectual and developmental disabilities and then what we are talking about as far as adult daycare centers. Those are two very different things and they are funded in different ways. So as we were talking about that last time around, I just wanted to make sure that that clarification was here within this group, that everyone realizes that those are two separate things. And also kind of along the lines of what Annette just said, utilizing senior centers because they're an existing entity. IDD service providers who provide day services are also an existing entity. and they're in a lot of different communities. And so one of the comments I had made on one of the jam boards, I don't even remember which one anymore, but was, you know, can we utilize that as an existing infrastructure and entity to allow, you know, older adults from the general population to come into those services and receive, you know, meaningful things throughout their day, kind of like what an adult daycare program would do. So thank you.
Thank you. Would anyone else like to share? All right, then I'm going to lead us through a quick exercise because we only have a few minutes left. But first, I wanted to center you by reorienting you to your vision statement. Establish and expand a clear path with public policy recommendations for Kansas older adults and caregivers to access services. So definitely keep that in mind. And then I'm going to try not to make you dizzy as I go down. But here's your list of recommendations. There's about 38, so there's quite a few. So we'll do a lot of combining of recommendations because we did see some similar themes come up. And we can start doing a little bit of that during the last couple minutes. But I want you kind of to look at 5 recommendations at a time. So, I am so sorry that jumped. So with 5 recommendations, these are the first 5. Any additional context or any of these that could be combined together to make them more meaningful or actionable. So take a look at the first 5. And then would you want to maybe send number 4 to the workforce subcommittee? So it can be kind of off your plate and on to another working group. So what are thoughts? Just looking at the first 5, any that could be combined, any that you would want to send to another group, any that you think are a high priority right now? So I'll pose the first question. Do you think that number 4 should remain in this working group or go to the workforce subgroup?
You know, just so somebody can weigh in here, Tanya Dorff with Oral Health Kansas. I think that makes a lot of sense to move that one to workforce, definitely. And others are more experts than me, but I would say 1, 2, 3, and 5 all seem to be, you know, have a lot of overlap. It just keeps feeling like there's this is the moment to really do some thinking about developing new models, and having significant community level discussion in large and small and rural and urban communities about how to use the resources and how to use PACE, use community centers, use whatever, and come up with new models. So I feel like there's not gonna, I'm just talking a lot here. I feel like there's not one model that can come out of this, but many, many models and many community conversations. And long story short, I feel like they fit well together.
Thank you. Let's move on to 6 to 10. How are these looking? Similar theme or different themes? Any that could be combined? Do you agree that these are similar to 1, 2, 3, and 5 as well?
This is Sarah Schlitter, JCDS. Yes, and I think a couple of those related to day services and childcare, we could probably combine into one. But I do want to just maybe piggyback off what Heather Brown had said, which we, you know, because Kansas does have a large number of IDD day programs, several of which focus on enhanced supports for those with dementia and older adults. So really utilizing those existing programs and services when we talk about how we can maybe improve the way we deliver services to people.
Okay. Let's take a look at 11 through 15. Looks similar here as well, similar themes. We do see some technology kind of starting to be introduced. And then volunteers were kind of the last theme that came up. If you look at 16 through 20, you start getting volunteers as well. Through 23 or 22.
Annette Graham, Kansas Association of Area Agencies on Aging. So I think there's certainly several of these that focus on senior centers and how to work with that and how to use that as an opportunity, as an option. And then you've got another section that is just on the volunteers and how to integrate that. So I think those are kind of some categories where things can be combined.
Appreciate that clarification. So could we unpack transportation maybe in the next minute a little bit? There's a few ideas around transportation challenges. One talked about leveraging kind of existing transportation services, and the other one talks about go to where seniors travel more. And so those are two different ideas. Would those be separate ideas you'd want to suggest, or would you like to think through? And you have time in April. These are the types of things I'd like the working group members to really think through, that as you are prioritizing your recommendations, really see where, if you want to pilot different types of models to see what works best, or propose both of those. But those are two different transportation ideas that come up as well. And then there is a little bit around incentives and definitely raising awareness to think about it as well. Here's another one that I was wondering if we wanted to send to workforce: incentives for employees, such as receiving respite services or a discount on daycare services for their own family members. Is that someone you'd want to keep? Is that one you want to keep in the group because it is providing respite services for their own family members, or is this one you'd want to also maybe send to the workforce subgroup?
Heather Brown, Johnson County Developmental Supports. I think that was one I had put up there. I do think it would be appropriate to send it to the workforce group.
Okay. Annette, were you going to say something
No,
similar?
same thing. I agree.
Okay.
I think that's where that would be best placed.
Okay. And then when we look at the last ones, oh, actually there's more than 38. Partnering with other groups, so that was a few, and then we just added in those other recommendations just so they were part of the list if you wanted to consider them. All right, so with that, I'm going to make you dizzy one more second, sorry, and bring you to where we are in the process. So today you developed recommendations on senior daycare resources. Your next meeting is next Friday, so April 1st. Topic discussion and recommendations on funding and implementation of the Kansas Senior Care Act. So you will hear from a few different experts that you identified a few meetings ago. You'll hear from Leslie Anderson, and you'll also hear from KLRD in the revisor's office. So you'll have some updates from them. I'll send that agenda out on Monday. We will try to get the meeting minutes out to you pretty quickly between meetings as well. And then there's like a little bit of a break. You have about 15 days. And so in that time frame, we are going to take all of the recommendations that you've submitted so far, sit down with your chair and co-chair, and if other members want to volunteer, let us know, and think through, again, kind of with that exercise, where can recommendations be combined? What are some themes that are being seen? What recommendations can be sent to other work groups? Which recommendations overlap across all three groups, to see if there's any of those. And then also to give you kind of a more manageable list than 40, to be able to really think through high priority recommendations. The other thing that we'll do on April 1st, if we have time, is start looking at a rubric on, what are some criteria or parameters to really think through how to prioritize your recommendations to the Senior Care Task Force. Definitely to give them the most actionable recommendations and a manageable list as well. So that is what I have for you today. Any other comments or questions? If I haven't mentioned it yet, one task force meeting date that has been proposed tentatively is for May 26th. during that meeting, your working group chairs will provide an update on progress and some recommendations. It's a good time to ask for clarifying questions from the task force as a whole as you're thinking through how to finalize your list of recommendations. By then, you will have started dwindling the list down, so it might be a good time to ask questions of the task force. And that is all. All right. Well, thank you so much for us meeting today. We will see you in a week. Take care.